My name is Jan Nilsson, and I'm Professor of Experimental Cardiovascular Research at Lund University in Sweden. I'm also Senior Physician at the Skåne University Hospital. I have for some years been working with a new and very interesting peptide, FOL026. And we have now demonstrated that this peptide can stimulate the repair of damaged vessels and also to stimulate the generation of new blood vessels. The results of this research have now been published in Pharmacological Research. I'm very happy that we've been accepted to publish our work in this journal because it's one of the absolutely leading journals in the world when it comes to development of new drugs. I'm also glad that at the same time we could present these results in the World Congress of Cardiology in Shanghai. So why is this important? It is important because damage to blood vessels is the major cause of myocardial infarction, stroke, and other major cardiovascular diseases. We have now been able to demonstrate that FOL026 can stimulate the repair. This gives us very promising results when it comes to possibilities to develop entirely new treatments for cardiovascular disease. And it's interesting that the drugs that we have available for prevention of cardiovascular disease today are all risk factor interventions. And we believe that this may be particularly important for patients that suffer from diabetes, because we know that diabetes is associated with much more severe damage to the blood vessels. Based on these very promising results, we will now continue to investigate if the FOL026 can protect the heart against the damages associated with myocardial infarction. And that's primarily the risk for development of heart failure. Thank you for listening, and I hope I will be able to come back later this year with more interesting results of FOL026. And I also want to wish you all a nice and relaxing summer.